Moving to the next pathology. So this one is what? Myelomeningocele. So we are looking at the pathology of this myelomeningocele. So for this myelomeningocele, of course, you know that it's a neural tube defect on a baby, where the spinal cord is kind of like pushing out from a defect, right? So myelomeningocele, we said that is the most severe form of spinal bifida, okay? And together we call them neural tube defects. So this one is resulting from failure of primary neurulation, you know. So specifically, there's incomplete closure of the neural tube between days 21st to 26th of gestation. So this leads to what? A protrusion of the spinal cord and the meninges outside. Alright, so what's the pathology features? First of all, there's a neural tube defect. So the neural tube is failing to close properly. So that's what is now leaving the spinal cord to kind of like get exposed out. So the various elements that are being exposed include the spinal cord tissue, the meninges, the cerebrospinal fluid, the nerve roots, okay, and they'll be covered by a thin sheet, alright, of epithelium or fibrous tissues, which can often rupture and leave it as an open wound like this. Okay, so histological composition: the squamous epithelium of fibrous connective tissues covers the dome. Inside, meninges, blood vessels, hyalinized connective tissues. Occasionally, striated muscles, cartilage islands, epidermal cysts. Associated malformations. You can also see the patient having issues like what? Chiari malformation, Hydrocephalus, orthopedic deformities like clubfoot, you know, hip dislocation, bladder and bowel dysfunction, and all of that. Okay. So etiology and risk factors is mostly the causes is due to when the mother was pregnant with a baby, folate, the way she was taking folate was not adequate, you know. Genetic predisposition, so you also have some genetic issues that can make somebody more susceptible. Then environmental triggers like the mother had diabetes, she was obese, certain medications, toxins. So implications: you have motor and sensory loss, cognitive impairment. Then prenatal diagnosis, there's elevated alpha fetoproteins and all of that. Okay, so this is what we have for myelomeningocele.